The youth are the majority population in the country, with reports indicating that they have the highest fertility rate. A report by Communication for Development Foundation Uganda, an NGO, shows that 23,549 teenage girls visited health facilities in Lao sub-region for antenatal care services in the last 8 months. The survey shows that adolescent girls were impregnated between January and August 2021.
What it means is that you have, first of all, a generation that is playing live sex. The issues of HIV/AIDS will be at the center of it. What is also true is that if you have 23,000 plus girls who are pregnant below the ages of 19, what it means is that they are also being defiled. And this means that our system is porous, that the parents do not have the capacity to contain and support the children, that the community is failing, that our system of government is not responding. Because if I may ask the DPC of each of the districts in Lango, how many of those cases have been reported to police and the defilers also taken care of?
Another survey conducted by Plan International Uganda indicated that a total of 8,736 teenage girls in the age bracket of 15 and 19 were defiled and impregnated in the sub-region between April and June 2020. However, the researchers concluded that the number could be slightly higher, since some could not have visited health facilities to seek antenatal care services.
They cannot access family planning services because of fear, because they are not talked to, because they are not guided, and yet we have these services within our reach and even at our disposal.
These can be attributed to limited access to information on sexual reproductive health and rights, poverty, negative gender norms, and poor parenting. Dr. Hilary Okello is the Lira City Principal Medical Officer and they in charge of Obel Center 4.
There are some that have interacted with them. And I would pose a simple question. That first tell me, do you recall really how you got infected with HIV/AIDS? Most of them cannot completely. Because some are having even multiple sexual partners. I've only talked of HIV/AIDS. But there are those who come with diseases like gonorrhea, syphilis, and instead of getting appropriate treatment, because they are lacking money, they are just there. And some of them come to the facility when they are almost rotting. So you can see, when you see these people moving around and walking in our midst, they are faced with very many problems. You will only know when you interact with them. You will only know when you befriend them well.
Other factors include ignorance, peer pressure, breakdown in social protection, and safety mechanism in raising adolescents.
To have a free-range generation, you know, when we keep birds and we say they are free-range, they can take anything they come across. So human beings should not be free-range.
Why would our children grow in a free-range system? I really want to challenge and caution the parents. Please, let's pick up our responsibility of mentoring our children. We cannot leave our children to grow at large. This is dangerous for our country.
It is against this backdrop that GLOFORD Uganda, a youth-serving transformative leadership and sustainable development organization, empowering youth and institutions to lead change right from self to communities and the nation, partnered with the CEHURD with funding from Swedish International Development Agency to build a movement championing advocacy to ensure that systems that support young people are functional.
We have already gotten started. A number of interventions are already enrolling. We have had community-based conversations, intergenerational dialogues, getting young people and the parents together, and the results are amazing. You'll discover that the young people are really very particular, that their parents are not that close, and open and providing the necessary support system, the correction, the guidance, the counseling.
Because a family is the basic institutions upon which the moral caliber, the moral trend, all aspects of morality is inculcated. Because the leader in that family is the leader of culture.
You find out that a boy is finding it hard to ask sensitive questions about his sex problems from his dad or from his mother. You see that? So really there's been a gap.
They feel it's a taboo to talk to a girl child about sex, even menstruation, among others. So you find that most times as young girls or as teenagers, you get ambushed by these changes, these natural changes in our bodies. You're seeing your period for the first time and you're scared, you know?
Because when I was trying to discuss with some group of young girls, they said you're spoiling our kids, you're doing this to our kids, you want our kids to become prostitutes, but it wasn't that. And also, if you see like, I also find there's a gap in involvement of boys, like boy child, because most of the things are coming for a girl child, girl child, girl child.
Participants in the conversations and the intergenerational dialogues felt that such interventions are necessary to bridge the gaps in addressing sexual reproductive health and rights.
Family planning job that I don't think you talk in a new world like they don't have talking for say I have about Malaya, Gary going on never family planning. I'm discouraging now when you're a warrior.
This dialogue was just like a mind blower, like a mind opener for someone like me. Right now as I talk, I can guide someone, I can guide a young person.
I encourage them to live as friends. And I was advocating for friendship that are not sexual oriented. You know, when you go for friendship that are some sexual, then you are getting into problems.
And political leaders, we have roles to play. Besides the roles which are supposed to be played by parents, but we have also a role to play, and the youth themselves.
So you can see the situation is alarming. We have these people medicines, they are suffering quietly, and yet they can be helped. So such dialogue is very important, can help us come up with a way of bringing these people out.
According to United Nations Population Fund fact sheet on teenage pregnancy of 2021, Uganda's maternal mortality rate stands at 336 deaths per 100,000 live births, and 12.2% of the deaths were among those aged 15 to 19. Reports from Uganda Bureau of Statistics also indicated that in 2018, 25% of Ugandan women have given birth by the age of 18. Sexual and reproductive health and rights are critical entitlements best supported through human rights-based approaches, empowering rights holders to claim their rights and duty bearers to fulfill their obligations.
When we talk about the broadness of our responsibility around family, we understand the depth of family planning. But if we just talk about the pills, the condoms, and those few things which are just at face value to provide sex, so everything is around sex. But it's bigger than that. Plan the family. So this is why we want to strengthen the family, to be able to take seriously the health and the future of their young people. And what is going to happen is that if families listen to us, what is going to result is that the population will be quality, which is very critical. And we are glad as GLOFORD to partner with our elders, our leaders, many of us in media and civil society and communities to drive that change.